Okay, thank you for all speakers. I think a lot of task for talking, but I would like to also introduce to our floor a very important person for me too, because he's my colleague from ELTG also. I would like to introduce Axel Vanderperre. Axel decided in 2016 to focus the project of added value to the patient of the medical professionals following a long career of more than 30 years in the medical and pharmaceutical industry in clinical research and communications. Within the context, he decided to work on strategic and operation level targeting for people living with HIV and their needs and translate it with operational projects. To achieve these goals, he decided to join different patient organizations and to develop a not-for-profit organization, Utopia, in Belgium. We focus on identification of needs and expectation of aging people linked with HIV and creation of educational programs with added value and innovation to the people living with HIV aging community. He is also coordinator of Positive Council in Belgium and active member of EATG, and founding member of the International Coalition of Older People Living with HIV. Axel, join us. Come on. It was everything about
he's waiting for applause.
Another applause. He wants more.
Because I'm hidden.
Just trying to catch more attention. That was
one
the
more
way.
applause.
Again.
Okay, I'm coming.
Axel, before we start the discussion, can you add something from your perspective about stigma and discrimination, also in your topic that you concentrate mainly about aging?
Yes. Well, I took, because I didn't prepare anything. What should I say? I put some little phrases from all speakers here, which in fact could be used in my topic. The first speaker was speaking about human rights. He was saying investing too little. Then Eliane was speaking about improving the healthcare system, growing up positively. And then at the end, it was about refusing treatment. Now, my topic is aging. The word aging was mentioned somewhat. It was not officially in the program, but I'm very happy that the topic came, because when you hear about vulnerable populations, transgenders, sex workers, and so on, there is one big population which is not mentioned a lot, which is the aging HIV population. And in a lot of countries, it's 50% of the population, and this population is aging. And there are some, I saw some epidemiological studies. One showed that in 2030, 70% of the HIV population, also in your countries, will be more than 50%. And why I'm saying this? Well, I will not give the topic about ageism. All the people in society are somewhat put aside because they are considered to be not active anymore, not producing, and so on. But my topic I would more put in front is treatment. We speak a lot about HIV, and HIV, the pure CD4 counts and so on. But HIV is becoming more complex. Aging people are getting more comorbidities. Eliane, you were speaking about this hypertension, diabetes, and all this is proven. The HIV population which is aging from 50 years on gets more comorbidities, diabetes, cardiovascular, some cancers, and I don't speak about all the mental aspects, anxiety and so on. Well, I come to this to say that, in fact, in the healthcare system, we spoke about healthcare systems, this is not considered enough. And this is discrimination, because when, as my personal life is that I have comorbidities much more than the seronegative population, hypertension, other cardiovascular arrhythmia, neuropathy, that's pain. A lot of HIV persons have neuropathic pain. I come from the healthcare system. Well, it's very tough for me to get to the right specialist. There is no follow-up, and so on. Thus, the system is not fit to give a response to this population. And for me, this is discrimination. I stop with this.
Thank you so much, because I think we'll go on to questions from the audience, but just as you were speaking, when Teymur was presenting some of that, the data about the healthcare system and the experiences there, it really stuck out because it's really high percentages. And I wanted to really generate conversation about what do we do about that? Because we see it consistently. Last year at the last conference, I presented the UK Stigma data, very much similar. So, but where do we go next? And then in your comments, Axel, the point of that stigma of clinicians not seeing you. So they're not seeing you in your entirety of who you are and what is your lived experience and what could be affecting you. And I think that level of stigma is, as you say, really, it's not talked about enough. And again, what initiatives are out there? What should we be doing to kind of change that mindset? I'm looking at you, Teymur. He's thinking that's a big question.
Yeah. No, I mean, as I'm listening to you, and being a person not living with HIV, it is striking to see this data. It is. And what can we do about it? Well, I mean, the boring part for me is we need data, right? And we're doing this survey now together with EACS to see what is the level of stigma among healthcare workers, not only doctors and nurses, but administration staff and many different kinds of staff. So that's going to be really important. Already now, in anticipation of the results, we're discussing with EACS what we can do about what we are anticipating to find, in terms of educating in medical schools and nursing schools, etc., try and bring this up again. We're trying to understand in the survey whether or not they are trained in their education around stigma, discrimination, around key populations, and also if they have professional development once they are in the healthcare setting, if these issues are being discussed, and based on those results to see if EACS and other professional societies can do more educational work. But that's on the top of my head on what we can do about it. But it starts with data, because that's going to inform programs and policies. I think already the results from this community survey that we did with the ATG and AIDS Action Europe is now informing policies. We had a high-level meeting during the Spanish presidency where these issues were discussed, and Mark Angel, we heard from Parliament, is organizing a parliamentary event and World AIDS Day to bring these up. But there's no guarantee that changes will happen, but we need the data to start the discussion at least. So I don't know if anyone else wants to jump in and see what we can do about it.
I would, if I may, I will also add, because many years ago when I made a PhD in Poland about stigma and discrimination in people linked with HIV, and I'm a sexual educator, so I remember that the most fighting part of the life of living with HIV was that I can infect somebody else. And when I see this data, it's so similar than 10 years ago. And do you see any impact of you equal you? Because I thought that it changed a lot and will be changing also for people in HIV for their perspective, and also it should change just even a little bit stigma and discrimination for people in HIV. And I don't see impact of that. It's a huge impact of medicine, but it doesn't change the real life of people living with HIV. So were we going on the misway that there is no impact, people don't know it? What is your perspective of that? Do you think it should have any impact of that?
Actually, I remember one thing, what Teymur said when he participated at our conference, HIV Istanbul. He said, perfect shouldn't be enemy of the good. So sometimes we're trying to change entire world or entire country or entire city. So maybe start from the little communities and see the effects, and then make maybe small community surveys, because as he said, data is really important, and I'm always surprised that this is kind of first survey that now we have kind of huge data about the stigma and discrimination. So we know that you change many lives, especially on HIV positive people, but actually the campaign just, I mean, yes, we are saying that maybe 6 or 7 years old, but actually still new campaign, and there are still lots of problems and missing points. And I'm pretty sure if we insist to say, to shout out our message in few years, maybe not entire society, not entire community, but step by step, everything will change. So we should keep knocking the door and should stay there. I think that's the most important thing, because sometimes we're waiting to see the results in very, very fast and very quick way. So this is not the way. Life is not changing that quickly, especially in this kind of stigma and discrimination.
We would like to also include people who are speaking on internet. If you would like to be part of the discussion, please add the question and we will give it to our guests here. Eliane.
Yeah, I was going to say, like, well, it cost us 40 years already. We haven't found any solution on this stigma and discrimination. And I think it's still sad that in a healthcare setting, we still face this kind of discrimination. And so I think we should just start training maybe the nurse at medical schools to make sure there is a program about how to learn about HIV, everything that goes around HIV, so then they know already the basics information. Maybe when they treat a patient living with HIV, they will know they don't need to be afraid that they're gonna catch HIV by touching us, you know. That's really starting point, because we will keep on sharing the data. My data doesn't tell anything at the nurse in my hospital in Amersfoort, because she didn't read that data. She has no idea what is data, what is it. But when they know about U, when they know there is a PrEP, when they know we are safer when we are on treatment, then they will know they don't have to be afraid of us. Thank you.
So over to our esteemed audience. Any questions that you'd like to put forward to the panel? We've kind of kicked off the conversation in terms of the health system and just reflections on U, but we all know that everyone here has got their reflections from their countries and their experiences. So we just love this forum for people to share and just learn from one another. So any comments, questions at all? First of all.
Good evening. My name is Andreea. I'm from Romania.
Lovely.
And I was thinking a lot while you were presenting, and especially while you were talking about what can we do after more than 40 years of HIV, and we still deal with stigma and discrimination. And I'm living with HIV since I was 8 years old. So I'm 34 years old now. So most of you kept talking about teaching people, other people, population, nurses, like professionals, populations from our countries. But we did that, especially at the beginning, and many years after. Or at least this is the case of Romania. We did it many years, and then we stopped. And it's not working. And what I think, for me at least, I think we should also look at us, people living with HIV? And how can we be empowered and stop being afraid of defending our rights when our rights are not respected? If we go to dentist, as Eliane said, why don't we react? Why we just step back? Because yes, I know, we are tired, we are afraid, but why don't we look at finding a way of empowering people living with HIV, more in the sense of fighting for their rights? This is the question that I'm opening here for all of you, actually. Thank you.
Thank you so much. A very powerful question to open up, and I'll hand it over to anyone on the panel.
Well, just before you were speaking, I thought to say something similar, because we can expect from society that society is changing. And you have U equals U, which is not easy to understand. That takes years. But you are a person which can be empowered. And I give a story. The last time when I went to an ophthalmologist, I didn't know if there was a link with my problem and HIV. Thus I said to him immediately, but with a certain power, not afraid, I said, you know, I'm a person with HIV since 34 years. I spoke a little bit about this, and this guy was immediately positive. But it's because I was trained, because I trained myself to say it. I think the associations, maybe also some medical professionals, can help in what you say. From yourself, going out positively. And if you are positive, there's more chance that you get a positive answer. But I see still that there is a lot of anxiety. It's shown in the studies and so on. I did also studies in Belgium. There is still big anxiety. And what I see, for example, in the social media, for example, gays are a lot on social media. Instead of saying indetectable, they say, yes, I'm PrEP user, because this is more easy. Just still, there is, and I fully agree with you, we should also try to, and workshops like Eliane is doing, but different kind of workshops could help in pushing not only the activists who are here, but the base to go up and be positive. And it's not only a word. You feel you're much better when you say, without anxiety, what is your situation?
Thank you so much. Anyone else?
I have to say thank you, Andreas, for your question. But as always said to many HIV positive people who are not open yet, I said, like, it's very important when you accept yourself. What is the problem is when some of us mostly are suffering from self-stigma, and then when you have that, you haven't fully accepted your status. It's very difficult to fight back whenever outside of your world they are stigmatizing you. So what I always say, first, accept it. Then you know what is the storm is coming to you, how you're gonna fight back. Then it's better. You have always to think first, how do I handle this situation? If I'm going to confront this person, how is outside if other people knows about my status? Then you have to accept first to be open. You cannot fight when you are hidden. It's not possible. First you have to come out. Somebody has to know about it, then you can fight, even if it's in a hospital, if it's your neighbors, but you know, the moment you want to fight back, you are open. So that's the only thing I have to share with you. And then once you, and I always say it's up to us to fight, because no one else is going to do it for us, because we are the one going through that pain, and you want it to be over, you want to get rid of it, then you have to stand up. But then you are going to open that curtain that has been covering you. Open up and then go. And then join forces with the other people who are also open. Then we make a nice big movement of stigma fighters. Let's go. Thank you.
There was a question from Julian.
Sorry, my name's Julian Howes, and as you can see, normally I'm, more blatant than latent in most things I do. But I was going to pose to the panelists that, yeah, we had this mantra that everybody who is HIV positive ought to come out, and that will, build up our self-esteem and empower us all. But there's another way of looking at it. Stigma and discrimination does take away the agency. We're forced into having secret and, secret lives, and shameful lives. But we're also all entitled to a private life. It's part of the Universal Declaration of Human Rights. Mm-hmm. So the thing is that what I want to see is a situation where you don't have to damn well come out. Why are we forcing that upon people? Yeah, we want a movement, but we also have that thing. So I'm wondering how the panel looks at that thing of how we create something where it doesn't matter if you come out. Your rights are still there. That you're not forcing that expectation upon somebody that they're having to stand up and be counted. Because some people, as we know from treatment, just want to get on with their lives.
Yeah.
Thank you so much.
Thank you.
I can see some...
Yes, what I want to say is that obviously you have the right to be in secret, and you don't have to say to all people that you are HIV person. In fact, you are not only HIV person, you are a person. And thus, HIV is a part of that. But, and data show, a lot of people, they are anxious to say it. And I think that's the key issue. If I see that X percentage, I forgot percentage, but let's say 5 or 10% are not even saying to their friends that they are HIV, there is the problem. But I agree totally that you don't have to say to every man or woman on the street. But there is an issue to say, I am HIV person. That's for me the issue.
Yeah, it's also very often in this kind of questionnaire, it should be also include who would like to tell about your HIV status. Not only who would tell or not tell, but who would like to. And that shows why you are not speaking, because if you would have cancer, probably you will say about it, your friend, your family. So why HIV is this topic that you don't want to share with? What is the next step? What is the reaction? Why you predict the situation? And it's some kind of self-stigma, but it's also your imagination what can happen. And also what you are talking about, saying openly about the HIV status. For many years we're trying in Poland to organize campaign about saying openly about your HIV status. But many of my colleagues said, but you know, Magda, I can openly speak about it. But my mother lives in small city, a small town. You know what will happen with her life. My kids living in the garden, my kids are in the kindergarten. So you know what would happen if I will disclose my status, how their life looks like. So in many cases, it's not only your own, but it's also about your family. Are they prepared? Are they ready to take it? Of course, it would be much easier when they could openly speak about it and nothing happened. But for many reasons, they exactly know what will happen because of stigma and because of discrimination. But this is like a circle that if you don't tell, people don't see you. If you don't see you, they think that it's not a problem. If they don't think it's a problem, finally, if somebody find out you're HIV positive, there was surprise that, oh my God. So this is also, I agree that openly speaking, people living with HIV, it's the very good way, but you have to be also prepared. And we also have your own shadow who helps you, because sometimes it's easy for you, but it's not easy for family. Yeah. And when you see how they hurt because your HIV is even more painful than if you only talk about it. So you can also share your experience, how it looks like in your situation, because it's powerful that maybe nothing happened.
Well, it's not that nothing happened when I was open. Firstly, I just put it on the Facebook to share like my 10 years of hiding, you know, taking medication in the toilet, hiding when my parents, visiting. And then I have to hide my medication before they come in. But then when I shared that information, I lost my volunteer job in hospital immediately. But I didn't give up. I took them to the court. And then I demand, like, people living with HIV, we are just healthy people. We can function. Before I tell my story, I was already, before I came open, you received me, I was doing my job well, and that nothing wrong with me. So, and then they accepted that they're going to let everybody who's come to work at that hospital to volunteer with the HIV, no problem. That was the winning. But at the primary school where my children were going, that's why I was going very difficult. They are pushing me and my children to go away from that school. I said, no, it's not possible. I am not leaving, because why would I leave? Because other parents are threatening to leave our school because of you are going to infect the whole class, your children are going to infect it. I said, my children, they have nothing to do with my status. I fought very hard to be accepted again to that school, but that cost me only 2 months to go back to normal life again at that school. But I didn't give up, because I knew the moment I was open, the storm is coming, what I'm going to face, that I have to fight every corner. But some stage, it was normal again. Children were just normal at school, and the parents were just inviting my kids to play with their kids. But for 2 months, it was like close. But my children, they were already, I informed them. My youngest son was 7 years, another one was 9, another one was 12. They all already talked to them. I talked to my neighbors. So I have a small family already, small village of myself who are going to support me. In case outside of the world they reject me, I have people to fall to do who can support me. That's the secret. I knew if outside I get a lot of bullets shooting on me, I have a small village. I built it myself by telling one by one by one. And then that's how it went. And until today, I'm just... a global citizen.
There's a question?
Yeah.
Gonzalo?
Thank you so much. Good afternoon, everyone. Gonzalo from IAPAC and the Fast Track Cities Network. My question to the speakers is, we know since the 90s that stigma kills. HIV-related stigma kills. And we have been hearing this a lot since the 90s. But I haven't come across data, and I believe that's an entry point from a public health policy perspective, is how much of the late diagnosis proportion is stigma responsible for? Because that's the access that we are not granting. There is where the system is failing in terms of the healthcare that is provided to specific communities. So I don't know if you have come across some data on this, because for full disclosure, I'm a clinical psychologist, and I don't believe we are going to change the world. I don't believe we are going to change behaviors from people individually if we don't do it by some type of reinforcement that is evidence-based. Thanks.
So, Gonzalo, I didn't understand. So keep the mic there, please. Gonzalo, you talked about late diagnosis, and what was your question?
Well, the question is, how much is stigma responsible for the late diagnosis part?
Okay. Well, I don't know if I can answer that question. I know that late diagnosis is very high. It's more than 50% of those with the CD4 count at diagnosis, and it's been persistently over 50% for the past 10, 20 years. It's very difficult to do something about that. So it comes back to testing. What do we need to lower the threshold for testing? How do we bring testing to communities? And I think we are seeing movement in terms of policy changes towards making different new innovative approaches to testing available to key populations. But there's one thing to make these available, but there's a different thing to actually implement these self-testing, home sampling, those kind of testing options at scale. And I think there are some countries that are doing better than others. Netherlands and the UK, I think, have lower lower late diagnosis rates than other countries. But I can't tell you I can't answer your question directly on the exact measures around this, but I think it's related. I think it's definitely related. Many countries still are relying on healthcare setting testing, that you have to go to the healthcare settings to test, and that's where the stigma comes in. We saw the high rates of stigma in the healthcare settings, and therefore it's a barrier. So we have to lower the thresholds for testing with these new options, emergency department testing in the UK, self-testing, home samplings to do that. But yeah. I don't know if anyone else wants to jump in here around this issue.
I may just jump in just a bit about, because I think it's a really important point, and when we look at the data, it's really difficult to tease out, but the main place that you get that data is from qualitative data. When you speak to those that have been diagnosed late and ask them to reflect on life retrospectively, and that still has a lot of bias, but it gives some insight. And when you do that and you see that, you're right, stigma is right at the root of it. And I think the reason that I pick out what you've just said is when we're thinking about policies and making sure that our leaders are still interested in stigma, so that we get to a point, as Julian says, that it's not the individuals, but it's a system around that gives good governance, so it doesn't matter whether you tell people about your diagnosis. I think that the figures of late diagnoses are really powerful, and those are real solid figures to say to policymakers, this is unacceptable, because it gives a physical marker of the manifestation of stigma. But yes, yeah.
Yeah, but I will follow this topic about testing, especially when you have anonymous testing. And from one side, it's good that you have this kind of option for testing, but from other side, do we need any special agreement for HIV tests? What to do that it will be much easier to do it just like that, like other tests that you have? Because from Polish perspective, many people even afraid to go for HIV testing, because going for HIV testing, it's some kind of stigmatization, that what people will say if I'm just going for testing. So maybe we have to go back one step and see what is going on around testing and fear of testing. And this is also the reason why we have late presenters, because people from one side afraid of testing, from other side, especially from my country, 87% of Polish people think that HIV it's not their problem. So they don't have any idea why they should go for testing, because HIV it's not their problem. So this is a lot of different things happened, and because we have so good treatment and so good quality of life, it's not enough. We have to beg for testing, knowledge, education, and other things. Rosalind.
There you go.
Yeah, I'm Rosalind Bayer from Germany. I just wanted to, Julian, what you just said is something very, for me, correct. We don't have to have people disclosing their status before people. It's a human right that people should be treated in the right manner. And stigma and discrimination, to fight against stigma and discrimination, coming out is a key. One can do that, but you have people, they don't have to come out. There are many people that are HIV positive, and they are living, comfortably with themselves, just like having, cancer, whatever disease you have. But I think the systems, especially in the healthcare system, it is, we are living in 2023, so people should be informed. There should be awareness. If I'm an healthcare professional, I should know that when I have, what are the rights of the patients, how I have to administer treatment to them. So I think the systems have to be called into question here, and it's very, very important, because for Africans the stigma is even double. The race being black, you are stigmatized, and the stigma within the community is so high. I have somebody, I wanted him to do a test. It took 6 months before you could do that test, because not being HIV positive, but everything associated of just being HIV positive was so big. So I think it's very important that this, the healthcare systems have been, addressed, and that they should take responsibilities. I don't see a reason why people should be laid off work because of their status. I think it's a right for everybody, and people should not talk about their status. If they want to, yes, but it's not a force.
So much.
Can I say something?
No, please go
Yeah.
on, and we have lady in
Oh,
the back.
thank you, Rosarina. Yeah, you remind me of how often I hear from nurses. Oh, yeah, it doesn't. I'm not surprised. You're from Africa, and I always say like, well, we have World AIDS Day as a problem, not Africa AIDS Day, right? So, yes, you're right. We don't have to open to disclosure our status, but you can stay quiet until the moment you get a place where you are reminded of your HIV. And then what? Then you go back home, and then you get depressed about it. So I consider for ages that HIV stigma and discrimination, I see it as a war. We are facing a war. For 40 years we haven't, and we need the soldiers, right? You cannot, there is no freedom without struggle. So this is kind of struggle we are doing. And there have to be some people who has to fight. Not everybody can pick up a gun and fight this war against stigma and discrimination. But the one who can do it, and is not, you don't have to be HIV positive. We need also HIV allies to fight together this. That's why we call also healthcare professionals. If you are here and you don't know what is you because you. What are you doing? How can you treat a patient without knowing the problem, what is going on? And you treat us differently. This is what we're asking. This healthcare professional, change, wake up. It's 2023. Why do you still discriminate people like living with HIV when we are on good treatment? Treat us like a human being. That's only what we ask. But you are forcing us to start fighting, and then the one who will stand up, but the rules is always there, the law is there, but people always breaking the law. Some people, they don't even care about it. So what then? What do we have in hand? It's just pick up and fight back. Sorry, thank you.
I don't know, it's Ben or Grzegorz?
It's Ben. Hi, I'm Ben Collins, based in London in EATG and Reshape. I'm sort of following off of what Rosaline said about the experiences that Africans have who may not be HIV positive. And I often wonder if we're measuring the wrong things, or if there are other things to be measured in addition to what you're talking about. I have no doubt the statistics about stigma and discrimination against HIV positive people is terrible. But I also have no doubt that stigma amongst the key populations who make up the HIV epidemic is also very terrible. We know that trans women, for example, have terrible times getting health care, whether they're HIV positive or not. We know that sex workers don't get cared for. We know that tons of people are stigmatized and some of them happen to be HIV positive, but they're part of populations. So I am going to have a question here, Teymur, it's going to you. But what do people think about the idea of exploring stigma amongst key populations and looking at that, and also amongst key populations amongst each other? There's a body of work that's being done about intra-minority stress, saying that there's minority stress, but there's also intra-minority stress, that people in our communities are stigmatizing each other. And, I think it's all well and good to talk about building forces and working together, but that's not happening in this decade. And I can see that, I think your name's Andrea from Romania. I can imagine that she's probably really isolated. And Andrea, I would expect, I'd suggest that you hopefully meet with some other people and really do come up with some possible things that you can do together, because I think that is what's really going to make a change, is people getting the strength and the courage to work together. But some of that is actually having to go to our own communities and say, we have to work better together. We're not paying attention to each other's needs. But what do you think about
I think,
measuring some other stigma in those communities rather than just HIV?
thank you so much, Ben. That's fantastic. I think there's two strands, and I think I can see Andrea wants to jump in, so I'm going to let Andrea and then give you some time to think, Teymur.
Thank you for continuing the discussion. Actually, I'm not isolated. My question wasn't about disclosing. It wasn't about that. I was just asking you, how do we empower people to not keep their heads down when they are discriminated, not disclosing? And as for me, I'm talking from my own experience, because I managed to understand that if I don't keep my head up and fight for my rights, I won't be here. So that's why I was raising this question. From my own experience, and in Romania it's quite hard to find people that are eager to jump and to just defend their own rights. This is the only thing, because that's the problem I face in Romania. Yeah, that's what I wanted to complete.
Thank you so much, Andrea. That's great to have that added context. And Teymur.
Yeah, so Ben, I mean, there's 2 points. One is a red thread that I'm hearing all over the place. It comes to Julian's comments, it comes to your comment, it comes to your Ben. But your question to me was, measuring stigma beyond HIV, and that's, I get questions around that. I hear this at the ECDC, I hear this in other environments. What's so specific with HIV? We have stigma among people living with cancer or diabetes or something else, and they're always, not always, but I hear that, that's a common issue. And it is a common issue. There are other areas, of course. I think there's particularities around the area that we work with, and you mentioned it, it's the key population issue itself. You're already stigmatized. I remember when I studied in the UK 25 years ago, I went to an open lecture around HIV, and that's how I got into the area of HIV. And it was from a psychological perspective, because I'm a psychologist. So it was really about how do you deal once you get the diagnosis of HIV, how do you deal with that, and what are the mechanisms for dealing with such a diagnosis? And she was speaking from the South African experience, and I, coming from Sweden, I was like, well, coming from Sweden, it's very different, probably how you handle the diagnosis as a gay white man from Sweden compared to a black man from South Africa back in the 90s. It's very different mechanisms, right? And I'm just trying to think what my point is here. Very different experiences. And but basically, I don't have an answer to your comment. I think it's important, but now we're here to focus, and I'm here to focus on the HIV experience. But I think there are similarities. My point here is what I'm hearing from Julian's comments. Yes, you don't have to disclose, you don't have to come out, but and what you're looking for and what you mentioned, Ben, I think the key for me is that you have an enabling environment. And I'm not sure I like that word, but my point is there should be, and this is what I found in my research as well, the importance of NGOs and community organizations, that if you get diagnosed with whatever disease it is, if you meet other people in that situation, that's huge relief to meet somebody who's gone through that experience. And you go from a norm in society, which is heterosexual, whatever, and then you come to through an NGO where the norm is HIV positive. That is a huge relief of the burden of carrying that disease, and you can speak about their experiences. And I'm saying this because, measuring the response in Europe, we do try and monitor, how countries are funding the HIV response. And what is being cut are two issues, especially post-COVID. Testing was the biggest impact on testing when it came to COVID, and also funding of the prevention and NGO networks are really severely impacted. And I think that is super important for the issues that we're talking around stigma, is that if we're cutting down the funding to community organizations, that's going to have a very detrimental impact, I think, on the ability of people newly diagnosed, not only newly diagnosed, but people living with HIV, if they're taking away that possibility to meet other people in similar situations, I think that would be devastating. So I think that would be something I would want this meeting to come out with, is how do we try and sustain the level of funding for community organizations in tackling stigma and discrimination. I don't know if anyone else will jump in there.
Thank you so much, Teymur. Did you? I think Axel.
I would like to come back what Ben Collins is proposing, to go broader than the HIV population. It was said already, the importance of qualitative data, because I'm not in the HIV activist field since 20 years, only 8 years, and I see always these kind of figures, which are quantitative. What I would think which is useful always is comparing populations, and also understanding why the seronegative population is discriminating. What is it related to fear or to other elements? Because we speak about U is equal U, but we all know that this is a topic which is not easy to understand, but why? What are the barriers to understand? And I think if you go broader, not only quantitatively, but qualitatively, we speak about finding solutions. I think maybe we could find some solutions to give more food to the activists of U equal U, to go with maybe some other messages, or to rephrase it, or whatever. I think it's a nice proposal.
Thank you. I don't know, Arda, because when just listening to this, and I think, Ben, you brought up something about intra-minority stress and differences, and I think that's really important, and it's a whole different conversation, but something that isn't really acknowledged. And it reminds me of what Arda, you were saying about starting off small, changing our communities, and looking inside our communities to understand what is happening in those dynamics, and then go bigger. And I just wondered if you had any reflections on that.
I want to add some things actually. So someone said, even after 40 years, we're still struggling with the same thing. So maybe it means there are some lessons that we should learn. So maybe community doesn't want to change. So then maybe we have to go. At least this is my own experience. Sorry if I'm talking like a stupid, but so we have to be pragmatical. So maybe we should stop to look for kind of golden formulas, Yeah. So in this setup, this can work. In that setup, that can work. So that's why I said that maybe we should start with small communities, and if there is an entire community or specific community that doesn't want to change, okay, then I can wait for them, or I can left them and I can go the other direction. So because if we're talking about empowering people living with HIV, so our first obligation, or maybe first target, to make them feel better with their life, with or without HIV. So when they're feeling happy, when they're feeling more peaceful, maybe they can start to, they're coming out, and then in the small setup, in the small community, and then maybe they step by step can try. But being fighter is not obligation. So they just everybody just want to live happy life. So at the end, that's the thing. So, and my offer, or let's say my lesson, from my past experience, if somebody doesn't want to change, I will not going to insist. So, and then I can go the other direction, and then maybe I can come back later. Because I'll also, my time is limited, and also I want to live happy and peaceful life, at the end of the day.
Okay, before we end, because we are just in the end of our session, I would like to introduce you, because during the few days, during EAC's conference, there is a lot of different community engagement events, and one of them, it will be 19th of October at 7 p.m. It will be amazing movie, How to Tell a Secret. It's organized by People Living with HIV, document how to disclosure your status and how they do that. They start from one person and increase for a huge active way, and it will be presented in Muranów cinema for free. So if anybody would like to join and see it, it will be on the foundation booth, access how to register. I think it's also the continuation of the way how we be engaged and how we can be powerful.
Fantastic. I just want to thank everyone. Just to thank our speakers and our panelists. We just picking up from last year, it was really important that we hear about new updates and where we are in different regions and what people are doing and the data, to think about next steps and to think about solutions as well. And this conversation, I think, has really first of all, opened it up for people, for us to start sharing together, but also starting to think about what needs to be done next and what are the pockets of and areas of stigma that we need to really focus on and work on together. So I just want to thank the panelists and speakers. I just want to thank the audience for your participation and those online. And we now have a break for how many minutes? 15 minutes, is it?
No,
50?
half an hour.
Oh, half an hour, look at that.
Wonderful.
Very generous, yes. So we have a 30-minute break, and then for you to come back, and it really links on to what was mentioned earlier
Finally.
about looking at stigma and key populations. So thank you so much, everyone.